Good afternoon, everyone, and thank you for joining us for today's Talking Bayside Tuesday session. My name is Kelsey LeCue. I'm Bayside's Community Engagement Officer. I'm joined with Carly McLennan, Bayside's Positive Aging Specialist, and our very special guest speaker, Lesley Pearson, joining us all the way from Western Australia. Lesley is the Regional Manager of Western Australia's Primary Health Alliance. Hi, guys. Lesley is going to talk to us today about the importance of innovative partnerships between local government to foster healthy and active ageing, also touching on ageism, elder abuse, and how to get the best out of the services that are available to you. After that, Carly's going to provide us with an update on where we're at with Bayside's age-friendly community strategy. Before I hand it over to Lesley, I'd like to acknowledge the traditional custodians, the Gadigal Bidjigal people of the Eora Nation. Their spirits and ancestors will always remain with us within our waterways and the land, our Mother Earth. If you do have any questions throughout the session, please just put them through the chat and we can address them at the end in the Q&A section. All right, thanks, Lesley. I will hand over to you.
Thank you, Kelsey. If we could go to the next slide, and hello everyone, welcome from WA, and we've got the sun shining here today, which is great, and I believe you guys have as well. WA Primary Health Alliance also acknowledge and pay respect to traditional owners and elders of this country, and we recognise the diversity and the significance importance of their cultural heritage, values and beliefs, and self-determination in contributing to the positive health and well-being of all of our communities. Thanks, Kelsey. Next slide. So from a WA Primary Health Alliance perspective, our strategic priorities are firstly around health equity and access, person-centred models of care, integrated and outcome-focused commissioning, strong partnerships and primary care capability. And I guess that really underpins that presentation that we're talking to today. Thank you. Next slide. So today we're really talking to healthy ageing and really around addressing prevention and improving attitudes towards ageing. Next slide. So as the first line of connection to people where they live, local government play an extremely important role in contributing to the social well-being of communities. In the Great Southern, in the region that I'm dialing in from, a public health approach has been undertaken to implement change and enable older people to enjoy long and healthy lives, feel safe at home and connected to their community. This approach means utilising the strengths, the capabilities and resources of individuals that our community have to develop a strong, inclusive and sustainable environment for people to live and die well in. Next slide, please. So we're just going to show a short film now for about 7 minutes, and this is around a workshop that we held in our region. And I guess part of this is really around recognising that transforming services for older people requires a fundamental shift towards care that is coordinated around a full range of an individual's needs rather than just being disease-focused. Essential to this is changing the way we think, the way we feel and the way we act towards age and ageing. In 2021, the City of Albany hosted a workshop for community and healthcare providers to discuss how we create a system to meet the needs and rights of people as they age and to generate real change. We captured the workshop in this short video. Thanks.
Ageing is one of this generation's greatest successes, the fact that we are living longer and people are living longer than any other generation in history. That in itself is something to celebrate.
Tonight's going to be about breaking down these ideas around ageism. How can we challenge ourselves to value the culture of ageing and caring for people as they age?
It's not until you have these sorts of events that we can have those discussions and really start thinking about how can we do things differently.
There are some unique challenges. Obviously, being in a regional area offers us some benefits, but some of the challenges relate to, obviously, the tyranny of distance.
Travelling to Perth is a huge obstacle for older people, not just costs away from family, the effort to get there.
Doing aged care has got particularly difficult over the last while because these are patients that are a lot of complex issues. They're sat in a situation where they're parked away in nursing homes, and we're very, very dependent on the staff in the nursing homes to provide us with the information that we need as to how these patients are going. But the ratio between patients and staff members looking after them is just really not adequate in these nursing homes.
Working with older people is a privilege. Unfortunately, working as a nurse or a care staff working with older people isn't seen as a valued occupation. It's seen as the bottom of the rung, which is so unfortunate because the skills required are huge.
We need to change the space in aged care in which we attract the most, dynamic, advanced, the best clinicians we possibly can into this field.
Once you're in there and you're doing the job, it is something different. You don't realise how rewarding it is for yourself to be doing it. But I think we do need to try and change the face of aged care to make it more appealing to other people, to get them into the industry.
Long hours, little support, a huge responsibility, underpaid. Stigma needs to change, the pay needs to change, and if you've got enough numbers, you'll find that the pressure will go off, it'll become a better working environment.
It's about providing the right environment, right social interactions, but even more than that, it's around valuing older people, valuing people who work with older people and providing older people and their families with choice.
I think we're moving in a direction of maybe thinking differently of how we manage things in the future, keeping people in their communities, in their homes, and working hard at doing that so that we don't have the aged care, residential care problem that we have, which is just going to get worse if we continue with the same model.
I think it needs to be a nationwide approach. I think there needs to be some ads on TV that see older people in a positive light and value older people, and maybe giving them more opportunities to contribute in society so they feel more valued and have purpose.
Us doctors and nurses and aged care providers trying to keep a lot of our aging population at home to reduce their presentation to like emergency setting or going into aged care facilities at a younger age.
If somebody's doing really well in their own home, that's where we want them to stay, but we want them to still be involved in community. Other communities use their elderly people to help look after the smaller children so that those people in the middle can go to work. Where did you learn cooking from? You learn it from grandma at home, We don't then have the older people that are lonely in their houses because they're with the younger children.
I was invited because of a family experience where I cared for my late parents in their home before they needed specialised home care. The challenges arose from allowing my late parents, particularly my father, to be in absolute control of his life as it reached its final stages. And everybody from the doctor through to myself was part of that. He maintained his integrity. He wasn't a client, he was a living, breathing human being with needs that were met.
I think we're now seeing, as a part of the sort of ageing of the community, a broader role for advanced care planning, which wraps up with, in a sense, how we age and where we age. Advanced care planning is both a specific thing at times about how we might want to die, but also, in many cases, it is a discussion that often broadens out very quickly, particularly when you start to discuss this not just with patients but with their loved ones, into a much broader area of how and where we age.
It's really good to bring people together, so it is important for people to be able to share their experiences and be able to network as well.
We're all busy and we all want the best for our patients. I think that collaboration that we have together, and hopefully then when new people come that they feel involved as well, and that it's easier to liaise with somebody that you know.
We can start from ourselves and then educating people around us, or passing message to any clients that you see in your clinics, or that start from this basic level.
What's been really exciting about these workshops is for us to, it prompts us to think outside the square.
It doesn't matter whether you're a doctor or a nurse or a care provider or a family member. we all make a contribution and we all value everybody's contribution because we have one purpose, and that is to care. And there are lots of ways of caring. That's why meetings such as the one today is important.
Thank you. We go to the next slide. That was a great segue into what that whole workshop was about, collaboration. And I guess one of the things that really underpinned that for us was that WA Primary Health Alliance partnered with the City of Albany to develop the age-friendly charter. And that approach was really around, let's not us decide what we think older people in our community want. Let's hear what they say that they want. It also, we partnered at the same time or shortly afterwards around our Greater Choice for At-Home Palliative project, which was had a focus around compassionate communities. And as part of that, the City of Albany created the first charter, nationally, around a compassionate city charter, which is pretty amazing. We're very proud of. Part of the success in that, though, was about co-location, and we co-located some of our team members within the community development team within the local government authority, the City of Albany, and that really, really built on our relationships, to which we are still reaping the benefits from today. So those initiatives involve working with the community to define their values and aspirations for older people and those that were experiencing dying and bereavement and loss. Building those networks and collaborations across our community with the service providers at all levels of government, so that we could work together to improve the way we age and we experience end of life. But from some of the workshops we don't have time to talk about today, there was a lot of talk from community about the trajectory of life. This is really from the beginning to the end. It's about encouraging communities and neighbourhood networks to play a much stronger role in supporting people and their families and carers at no matter what stage of life. And I think one of the very strong outcomes for us in our community has been those networks as we've gone through COVID. And certainly from an international World Health perspective, compassionate communities in itself as an international movement has now got a broader scope just beyond end of life. It really is about all of life. Next slide. So how did we do this? There was a lot of activities that we undertook with the City of Albany, such as the arts program with the Vancouver Arts Centre, dementia day care with Hawthorn House, and one of our greatest assets that we all have, our public library. Dying to Know program and exhibitions around memory of ordinary things, permission to die, and you can see there at the end there's a primary school poster competition on the life cycle, and wow, that was pretty amazing to see the perspective of children in that space. The mayor, who you would have got a quick glimpse of in that film, was key to our city. He had a very strong passion about supporting this from his own lived life experience, and his leadership led to staff participation actively throughout the local government. Advanced care planning, promotion and collaboration, such as digital storytelling with Your Voice, Your Choice, which we did in collaboration with a PHN on the East Coast. And the stories that were told there were from our mayor and also the director of community services, Rani, who now works with Bayside today. And they shared their stories, which was fantastic as well. The development of filmed case studies on network care in a country community and a workshop to support learning outcomes, and you know, just the example of a cycle club and how everyone rallied around for someone who really wanted to stay at home at their end of life. Pulling together a program of speakers for our Long Live You Health Cafe, which had topics to support healthy ageing. Was and has been and continues to be extremely successful. And what I mentioned earlier about COVID-19 preparedness, preparing for a COVID-19 checklist, we identified that we didn't have a preparedness that was at the level for our community. So we worked with the Department of Communities, we worked with State Health, ourselves, and the City of Albany to create a template. And that template is now not just available on the City of Albany webpage. Several other local governments have accessed that, but it's also on our statewide WOLGA webpage. So from something very small, something very great evolved. Next slide. So, what were the enablers? So the City of Albany has a well-established asset-based community development program, and that includes established neighbourhood networks developed through the City of Albany's place-based initiatives that reflect local assets in a geographically and socially diverse community. We have established hubs of community connection, like, for example, we all do in local government around the Albany Leisure and Aquatic Centre, Sporting Clubs Network. I mentioned Lonely View, empowering seniors programs, the Albany Community Library and Vancouver's Arts and Community Arts program. The City of Albany has its public health plan, which was developed in 2018 and is due for review this year, 2022. And that was also developed with support from our WA Country Health Service. So they co-located to support the City of Albany in the development of that plan. In WA, public health plan is mandated that all our local governments will be involved in creating one. And that is such a fantastic connector for us in health to really collaborate and partner. The public health plan is a prevention focus. It goes beyond encouraging individuals to change their attitudes and lifestyle, and it focuses on creating environments in which people live and work that support healthy living, well-being and quality of life from birth to death. Again, great to have community champions such as our Mayor, who speaks openly of his own personal experience with the death of his brother and advocated the support of the project within both the elected members group and the community. And it's always struck me, one of the things that Mayor Wellington talks to is that he does not want in our community that when someone is walking down the street and they see someone who is unwell, that they cross the street because they don't know what to say. So, we've heard those stories often. So it's being very open and supportive and networked. And part of this process also, we had a project steering group, which was made up of community advocates and champions and key stakeholders. Next slide, please. So listening to our community in developing the services and initiatives, both through the city and just through health, we've regularly engaged and consulted, and that engagement has really spread its wings over the last several years, most probably over the last 4 years. As experts on the community of Albany, WAFA has consulted with the City of Albany on the following. We've done and developed some ageism online modules, which we'll pop in and have a look at in a minute. Vulnerable populations, so obviously where we're looking at making sure that we have support for those during COVID around vaccination, around good nutrition, safe housing, and other like events. Also access and inclusion for Aboriginal people, homeless, youth, disabled and LGBTQI plus groups. So we might just pop in, if that's okay, and have a look at some of those learning modules that are available. They're free. We undertook projects with the WA Country Health and ourselves, and these modules are available if you go into WA Primary Health Alliance. So if we just click here on Understanding Older People Online Learning Modules, Kelsey, you'll also see there that there is, the modules are located, but also we have one there which we worked with Advocare around recognising, responding and reporting abuse of the older person online learning modules. That can also be downloaded on your mobile device. and there are two options there, one for managers and one for direct care workers, that you can click and go into. These were developed by eLearn Australia, and you will see some links into their webpage as well. The ageism online modules, we actually developed a little trailer which just goes for 7 minutes that we were hoping would be an appetizer for people to go and look at the case studies on the ageism online modules. We also have some modules that we've developed around medication management for the unregulated health worker, and that's sitting under health professionals. If we just click there, and then that should drop down. No, I'm not sure if that one's quite working at the moment, but those modules are currently being reviewed, and we will certainly let Bayside know when they are updated. We're just making sure with our pharmacists through State Health that the information is correct and up to date. And also when we've done community presentations on the aged care modules, that community members have actually said, can we use these? Because as we know, primarily some people are, self-medicating through their own Webster pack, or there's the carer at home that is supporting, and it's very, very adaptable to that, just to give people generally in community some more information. So that's it from me. If there's any questions or comments or queries that anyone would like to ask, I'm happy to take any questions.
Okay, so Lesley, we do have one question in the chat from Cherie. How did you deal with the online access for older people?
So the modules that are there around ageism and recognising, responding and reporting to abuse of the older person are for health workers and managers. So there's obviously legislative requirements around, particularly for abuse. So it was really important for us to ensure that we had that access available to our workforce in WA. The medication management modules, which are for unregulated health workers, is one that I'm not sure what percentage of people have been using that from community, that are just community members. And we are currently, as I said, doing a revision of that, and we will look at how we can make sure that that can also be adapted to be downloadable on mobile. And that could be it's a good question, because as we do a review, we could make sure that we think more about accessibility for the broader community, because that was actually the question they asked us some time ago. Yeah, thank you.
Okay, great. And just one more question in the chat. How have older people responded to the ageism material?
So we had older people involved in the co-design of the ageism modules. Again, the ageism modules are for all of community, and there has been a positive response. So people have been feeling that the fact that we're having the conversations, that we are influencing not only our workforce in health, but our workforce more generally. So the modules have been accessed not only in WA on our statewide tracks program, but some of the learning institutions such as Curtin University have picked it up with their allied health staff. So students, TAFE have also picked that up. Also, WA Police Force have also picked up looking at the abuse modules and getting a better understanding of the legislative requirements around that, so that they would be dealing in a more connected way with community. So we have had very positive responses in regards to the work around that. Advocare, when we did the abuse modules, went out to all of our regional centres and ran workshops, both for which included community members plus professional people.
Great. So it sounds like those modules are quite transferable and might be something that Bayside Council could pick up as well for use with our staff, yeah?
Yes, well, I was talking to eLearn Australia this morning, and they've had a couple of local governments being in touch with them that were interested in the ageism modules, but the case studies they would like to adapt for themselves, so it's more applicable to their community. So that would be something that we would support, obviously, from a permission perspective. Anything that helps from a national perspective to highlight the issues around ageism, to make sure that our older people are protected and safe, and then we all know what the requirements are in that space. And then just the everyday activities that people generally with medication management can be supported in their own home.
Great. Thank you for that. We just have one more question. Could you tell us about the Living Library? Were people happy to talk and share their stories?
Sorry, could you just repeat that question?
It was about the Living Library. Was that part of the presentation?
No, I spoke about the library being a great asset. Was it Live Long, Live Well project?
Yeah, maybe there was a bit of confusion with that one. I would just like to ask a little bit more. Can you elaborate on the Compassionate Communities project?
Yes, I certainly can, but I actually have the project lead, I think, who's with us today, Lisa Forward. Lisa, would you like to just give a very high-level overview of Compassionate Communities?
Sorry, I was just fumbling with all the buttons there. Hello, I wasn't expecting to come in. Yeah, so the project that we did with the City of Albany was really around the connection and using the City of Albany's assets to be able to improve on the community's sense of their responsibility for caring for people at end of life. So we did some fantastic work with them. We really had to start in a very early space because what we found is that people really weren't prepared to be having those conversations about death, dying and loss. There's a barrier there, you know, as soon as you start to talk about it, people have these kind of reactions where they start to shut down or they leave the room or something like that. It's an uncomfortable space to be. So we did a lot of work with the city around providing opportunities for people to be able to have those conversations in safe ways. And a safe way to be able to do that was through the arts. So communities being able to participate by going to an exhibition which might provide them with an opportunity to talk more about death, dying and loss and their own experiences and about what they wanted at the end of life. So that was a great enabler for us. We did work with the library, bringing in recommended reading lists around death, dying and loss, and just little pieces that we were always kind of consistently bringing into that community forum. And from there, we had, that grew into things like we have a summer school in Albany that has been going for, 50 years, and it's usually around arts and crafts, but also around lifestyle things as well. So we had a Death for Beginners program at the summer school, which was about talking about grief and loss, how to support people in your community, how to develop networks of care, and what does that actually mean around having someone who wants to die at home. And we got some really great feedback, and the City of Albany was involved and supportive through that the entire way. So, yeah, that project has been an incredible enabler. And even though our MOU with the City of Albany has finished, the City of Albany has continued on with some of that work. They've recently applied for a grant to be able to launch a volunteer program to help people that are experiencing serious illness, that are elderly and frail, that gives them some help at home, practical support with, things around the house or whatever. So they've continued on with that work. So, and we've embedded some of that into their community engagement strategy as well.
All right. Thanks so much for that, Lisa.
No worries.
Were there any other questions before we move on?
I was just going to add to what Lisa was saying. Lisa and I were chatting earlier this morning and talking about the impact of that project. And one of the greatest impacts, and I alluded to it earlier, was that the city of Albany became the first city in Australia to have a compassionate city charter. But what influence that has had is that the local government body in WA state government have put out grants for local governments to become compassionate local governments. So we've had 4 large, 2 metropolitan and 2 country pick up on that resource, but there's also, a whole pile of other smaller little LGAs that have the opportunity as well to be able to access that. So that's been a fantastic influence on system and system change, and I think a great recognition by the state government that they are funding and seeding some of these little projects with local government to go on that same journey. And I think that same journey will and is having a significant impact on our older population.
All right, thanks, Lesley. Last chance for questions before I just provide a quick update on Council's age-friendly community strategy. No.
Was there a question there on the Death Cafe?
Oh, yep, sorry. So I know that you had the health cafes. Were the topics different each time, or did you have a Death Cafe specific?
Yeah. So we do have a Death Cafe in our we have a couple in our region, and the Death Cafe has been quite pivotal in also being a point of contact, and we use that obviously opportunity to promote that. And we also have so we have one in Albany, we've got one in Denmark, and I think we've got one in Plantagenet, which is surrounding communities. So that open conversation is obviously becoming more normalised within the community. I remember when I first went to the city of Albany and I mentioned the Death Cafe, and when we were talking about co-locating in the project, and everyone was a bit aghast. And I said, well, actually, as a matter of fact, that Death Cafe operates in one of your local government buildings. And so they were quite surprised. But that whole shift you could see around the acceptance within the culture of the local government really did change. And it's a great asset, a worldwide asset that's available. So, yes, we've definitely used it and definitely promote it and support it. Thank you.
Thank you. All right. Okay, so thanks for that, Lesley. And so just a quick update from Bayside Council, I guess, is that we have been working on developing an age-friendly community strategy. This strategy will be Council's 4-year plan to ensure all people in Bayside experience the benefits of living longer and healthier and continue to enjoy opportunities to participate in community life. The strategy has been informed by community engagement activities undertaken over the past year, as well as data and demographic trends. It is also being guided by strong evidence-based approaches and literature on age-friendly communities and national and state policy and planning. What else should I say about it? We've also taken an early intervention and prevention approach to planning, which is why we're targeting older people in the community aged 50 and over. And consultation with the community actually wraps up with today's session. And once we have reviewed all the feedback we have received, we'll finalise the draft strategy and submit it to Council's Community Services Committee in May. And if the committee is happy with it, then we'll go forward to full council for adoption later in May.
I'd just like to thank both Carly and Lesley for their time today and a great and informative presentation. We really hope to see you again at next Talking Bayside Tuesday. And I just wish everyone a really lovely afternoon in the sun.
Thanks, Kelsey. Thanks so much, Lesley.
Thanks, everyone.
Thanks, everyone.